Today we've got 1, 16, 17, and 32. Looking at the pano here, see 1 and 16. Notice that the number 1 is kind of close to the sinus. I'm not overly concerned about that. Then we've got number 17. That's that distal angular thing that a young fellow that just out of dental school had reported on yesterday. So let's look at that one. So there you go. And here we go. Now, I normally start on the right side. It's more difficult for me to see over there, but today he was feeling a little bit on his, I start on the left side, not on the right side, but I'm on the right side today. And so he was feeling a little bit on the lower, so I went ahead and just gave a little more anesthetic and started with the right side, get the job done. And I think it was about 11:20 this morning, and I want to get out and go. I don't watch The Young and Restless, but I'll watch something on the DVR at the house, Burn Notice or something. Anyway, we're starting to loosen this thing with a 301 elevator. I start off with a Woodson WDS1 and go to 301, and I was just trying to loosen a little bit. In my mind, I thought this is going to be a tooth that I'll throw a 23 on relatively quickly. Once I get it moving, just a whisper, then just make sure that I don't get overly aggressive and break off a twisted root tip. But anyway, so I'm gonna go down. Now I try to work that 23 forcep down the buccal and lingual, and I'll move it back and forth to try to get it down in that furcation. Sometimes you can't reach it just by putting the beaks on, but you can see I've already got it moving, and I'm just kind of moving it back and forth. Now typically what you're going to want to do, and if you notice where it is, I didn't even ever get down to the furcation, maybe on the lingual but not on the buccal. Typically what you're doing with that 23 forcep is getting down and forcing the tooth up from up underneath. Doing a little cleanup work here, and now we're going to go back. I use a WDS1 Woodson. I like that 45-degree angle on that to release that tissue around the distal. Work real hard to try to release that tissue so I don't tear it if I do end up getting a little aggressive. 301 elevator, going to loosen that tooth up just a little bit and get it moving, and I can see it's moving pretty well. And like I said, just over the years you develop a feel for something, and so 150 forcep on that universal upper, and we're gonna look to grab onto that root or grab onto the crown of the tooth and wiggle it back and forth. And once again, I like to take teeth back to the palate. They tell you not to do that in dental school, but if you'll do that, I think you'll find that it compresses. Now you saw it just shot right out of there. And we're going to check to make sure we have all the root tips. That's one of the things that I do as a regular routine. I don't like to have my dental assistant do it. Although I've got one that's pretty sharp. Any question at all, if she's looking at it, then she hands it to me. But I do like to look at it every time. It's my job. It's on me if I've left something in there. So I need to make that decision whether or not I'm going to leave a root tip. Now, in my opinion, I try to get every root tip out unless it's going to cause a lot of problems. If it's up near the maxillary sinus, I may decide to leave it. I would recommend getting out as many root tips as possible. A root tip is a tiny thing. A root tip is not 8 millimeters long. And if you've got something that's that long, you better go in there and find it. Also, there's a little piece of bone that I'm just removing right there. That's the reason I like to curette things that may have just sloughed out eventually, or it could have sequestered them down the road. Irrigate out here with a little normal saline, and then we'll move over to the other side, just checking around, looking to make sure that everything's looking good. Notice that there isn't a whole lot of bleeding. Young 31-year-old guy, pretty healthy. And by the way, that young and 31 keeps changing as you continue to age. If you're 35, 31 might not be young, but if you're 60, 31 certainly is. So anyway, them open because I'm going to put that bite block right in between. Notice I use a bite block. I use a bite block on just about everything that I can use a bite block on, and particularly if I'm extracting the lower tooth. You put a lot of force, a lot of pressure on the temporomandibular joint, and if you want to really mess up somebody, go ahead and just grab onto them and do that yanks without having that mandible stabilized with a bite block. I've actually had a couple of patients that have dislocated their mandible, and it's no big deal, but you better be ready to put it back in because it's got to go. So I've got a bifurcated root here, at least that's what it looks like on the x-ray, and so I started moving it, and once again what I'm going to do is try to go right to a 23 and get it in there and let the 23 do work for me. I'm trying to find that buccal depression over there, and so I'm going to start squeezing a little bit. Now once again, you talk about a pumping action, just squeezing and then releasing and squeezing, and I try to work it down into the furcation. I'm not getting a lot of places here, so I'm just trying to see if I can slide it around, slip it around, move it around, just see if I can get it down in that furcation so I can grab a hold of it and get that thing to shoot up. Really when you squeeze the beaks of that 23, it's really trying to force that tooth straight up and out of the socket. I'm going to try a technique here. I decided that the typical 23 hasn't been working real well for me, so I think here in just a second I'm going to go back to the 301 elevator and see if I can get it moving a little bit more. But then we'll go with a different approach using that 23 here in just a second. So I find like I'm getting nowhere. So I can continue this all day long, getting nowhere, but this afternoon I will be nowhere. So I went back to the 23. Or the 301 elevator from the 23, and I feel like I've got the thing moving a little bit. Now, once again, it's not going to want to move a whole lot to the distal because you've got some tissue back there, you've got the bone back there. So I know that, or at least it's been my experience, that tooth will loosen a little bit to the distal, but it wants to come out to the buccal. So I decided that, well, I would try a little trick that somebody here on the extraction thread talked about. I don't remember who it was, Ryan McCall, somebody. But I tried again, once again, to go down the mid root. So now I'm going to the distal of 18, and I'm squeezing it, and that distalized that third molar into that space, and so now I go back to the furcation and start to wiggle a little bit, and you can see that the tooth is way elevated. It's up out of the socket. I'm going right back into the furcation, and once again just trying to move it a little bit. I like to move that force it back and forth, just try to get it wiggled into the furcation, and I'm having a heck of a time getting into the furcation. So anyway, continue to persist, and wow, no wonder I couldn't get into the furcation. It's because there really wasn't a furcation. I went back and looked at the x-ray, and sure enough, to me it looks like there's two separate roots and a nice big furcation, but there's a depression there, but nothing that 23 could get in and expand, go through buccal lingual. Do a little cleanup work here, and so see, once again, that tooth wanted to go a little distally, but then it got stuck there, and then you bring it to the buccal, the dude pops right on out. So let's see if we can go up here and get 16 out of there. And once again, as the WDS1 using that 45-degree angle, and we'll push around a little bit, release that tissue, and I just think that if the patient doesn't have to heal a big laceration that I've created by poor technique, then I think that they're gonna heal up a heck of a lot nicer. And just watching everything, I'm rotating the 301, getting it moving. You can can see the thing starting to move now. And you just want to take it slow and easy. You don't want to bust a bunch of root tips off, break a bunch of bone. You know, something that you're attempting to get out in 2 seconds. If you if you break something off, then it just increases the amount of time that it takes. You know, we're going on a total of 10 minutes and 30 seconds here with a four thirds. Anyway, they're little Christmas tree cone pointed third molar. Most difficult third I've ever extracted was an upper third. It had dilacerated roots that you couldn't see. One was coming right out at you, and one was going directly away from you on the panel. And when you slid it forward, you know, it was just rotating around those two aberrant roots. But anyway, eventually we were able to get it out. Go back with normal saline, rinse it out. Once again, you'll notice that there's not a whole lot of bleeding. Do I suspect the guy's going to be, you know, hurting? Probably not. I think we've taken a good care of him, and you know, it's now we're going into 11 minutes and 30 seconds, and we're putting the gauze in and going to pull out the bite block here and have him close down and slap him on the hiney and send him on his way. Basically, if you have a problem, get back with me, call me on my cell phone, and that's it.